Hi, my name is Dawn Magnusson, and I'm an assistant professor in the University of Colorado Physical Therapy Program, Rehabilitation Sciences Program. When I think about our program, our Rehabilitation Sciences Program, I think a few things that set it apart in my mind from other programs include first, just the breadth and depth of things that we do in our program. Not only do our investigators, cover the entire translational research continuum, we cover the entire life course, the lifespan. And so we have investigators who, like me, who are working with, infants and toddlers, young children. We have researchers who are working with young adults, adolescents and young adults, all the way up into older adulthood. And so for me, I think, as a student maybe considering different programs, I think the opportunity to gain exposure to that kind of breadth and depth of information is really critical. And I think because of that, our students really have an opportunity to gain exposure to a variety of epistemologies, methodologies. And for me, I'm a researcher for whom the question is really the most important part. And so our students are able to develop the tools and strategies to answer those questions, as opposed to maybe developing a specific methodology or method that you would kind of place onto a question, if that makes sense. So those are the things that really, I think, stand out about our program. As I reflect on my research journey, I think it's really important to understand a little of my history. And so I've shared with others that I worked for over a decade as a pediatric physical therapist, working with children and families in their homes. And I love that job so much. But I think it's through the privilege of working in families' homes, as well as through kind of my own lens growing up, I became really acutely aware of the challenges that many children and families had in accessing services. So there were many children and families who kind of are falling through our service gaps. And as a therapist, I didn't really know what to do about that. I knew it was a problem. I knew it was really bothering me, but I didn't really know what to do about that. Now I would say that much of my research leverages community-based participatory research to really understand those mechanisms underlying the disparities that are affecting services and outcomes for children and families. So that's the first part. The second part is using that information to co-develop meaningful solutions, community-based solutions to help address some of these gaps and disparities. And so that really kind of captures a lot of what my research is about. I look forward to meeting you sometime in the future. Please do not hesitate to reach out with any questions you have about our program, or if you'd like to start a conversation about opportunities here on our campus. We'll look forward to it.